To Health Check 10 now, Rhode Island has one of the highest rates of bladder cancer in the country.
Smoking is a factor, but now there's a new treatment at the Miriam Hospital. Here's Health Check's Barbara Silva.
Martin Israelite is in for a visit to the Miriam Hospital. He's being monitored after being diagnosed with bladder cancer. His symptoms began about 2 years ago.
Those symptoms were blood in the urine that were intermittent.
So 60 to 80% of these patients have blood in urine, and we should not ever think that this is caused by something else.
It started with a diagnosis of ureter cancer last November.
Ureter is a tube that connects the kidney with the bladder.
Martin had a kidney, his ureter, and lymph nodes removed, followed by chemotherapy. He then developed a secondary cancer in his bladder. That's when Dr. Dragan Golianin used new technology to help diagnose and treat it, something called blue light cystoscopy. It starts with blue dye that's inserted into the bladder via catheter.
So at the end, everything that looks as diseased, this tumorous tissue, will show up as red on the screen, and everything that's normal will stay blue.
To show you the stark difference, this is someone's bladder under the blue light.
And this is actually what we see. And here in this area, you see the area that's blue, that's normal. In this area, it's proven carcinoma in situ.
Compare that to what the bladder looks like under the typical white light. Big difference.
I'm very happy that I used blue light cystoscopy because I found 3 more tumors. They were very small.
It does seem simple, but I know that the advances, especially in light with LEDs, I was psyched to have the latest and greatest. I know there's very quick advances.
And now Martin is being treated with a vaccine that's used for tuberculosis to help stimulate his immune response to destroy cancer cells within his bladder. Dr. Golianin says short-term data shows blue light cystoscopy decreases recurrence and progression of bladder cancer. As important is not ignoring any symptoms of bladder cancer. Any blood in the urine or frequency, urgency, or pain while urinating should never be ignored. For more on this story, you can log on to turn10.com and click on Health. And that's Health Check. Barbara Silva, NBC 10 News.